My name is Lorna Pearson. I'm a Clinical Improvement Manager and Specialist Practitioner at East Midlands Ambulance Service.
My name's Lizzy Roebuck and I'm a Paramedic and Clinical Audit and Effectiveness Manager at North East Ambulance Service.
We led the latest review and update of the Altered Level of Consciousness Guidance, which sits in the medical section of JRCALC Clinical Guidance on the JRCALC Plus app.
This guideline has been reviewed and revised in line with NICE guidance. It includes important new information about driving and DVLA considerations for patients that have had a loss of consciousness. This is aligned to the sections around driving in glycemic emergencies and convulsions in adults guidance. Road traffic collisions resulting from blackouts are 2 or 3 times more common in those resulting from seizures. The DVLA has specific and legal regulations regarding causes of loss or altered consciousness. It is a legal requirement for drivers to inform the DVLA themselves if they have had a medical condition that could affect their driving. All licence holders should be informed that they must notify the DVLA if transient loss of consciousness occurs while sitting or following a cough syncope. When it is appropriate, particularly when you're discharging a patient who is a driver and you are not conveying them to a healthcare facility, you should advise the patient on the possible impact of their medical condition for safe driving ability and advise the patient on their legal requirement to notify the DVLA about transient loss of consciousness. It's then very important to document if any of this has been discussed with the patient.
It is important to take a good history and recording of any observer's accounts to aid a working diagnosis. We have included wording to consider any video recordings of the episode so that these can be reviewed by specialists looking into the cause of the altered level of consciousness. We have highlighted that it is important to distinguish whether the syncope occurred during exercise, when a cardiac arrhythmia cause is probable, from those whose syncope occurred shortly after stopping exercise, when a vasovagal cause is more likely. The guideline was reviewed as part of our cycle of aiming to update guidelines every 3 years.